Your body could be sending you crucial messages right now. Did you know that it is possible to detect cancer up to a month before the first symptoms manifest? Today we'll explore 9 key signs you shouldn't ignore. In the daily routine, it is common to overlook small warnings that our body gives us. For example, pancreatic or brain cancer often has no symptoms until advanced stages, making it difficult to treat. That is why identifying cancer in its early stages is essential. Early diagnosis significantly increases the chances of successful treatment and can save many lives. These 9 signs are fundamental to take action in time. The first is extreme fatigue. Being extremely tired is more than just feeling exhausted after a long day, or doing difficult things like running long distances or taking care of daily chores. Different types of cancer cause different types of fatigue. This is a deep fatigue that doesn't get better with rest, and it can make it difficult to carry out daily activities. Imagine that every step you take feels like walking underwater, and every movement is a lot of effort. You can't get rid of this kind of tiredness by getting a good night's sleep. It lasts all day and makes you feel exhausted every day. This happens because cancer cells do not use energy in the same way that normal cells do. To explain in more detail, cancer cells are busier and more demanding. What this means is that they need more energy to grow and stay alive. This energy comes mainly from glucose, a sugar that moves through the blood and powers every cell in the body. When cancer cells absorb too much glucose, they leave other cells in the body with less glucose. In this case, you may feel very tired, especially if you also have other symptoms like pain or weight loss. Take note of this because it could be an early sign of cancer. In unusual bleeding, there is bleeding that doesn't seem to have a clear cause, which can be scary and make you wonder where it's coming from. There are different ways this type of bleeding can manifest itself. In the stool or urine, it could mean you have colon or rectal cancer. In the urine, it could mean you have a problem with your kidneys or urinary tract. If you get nosebleeds or bruises for no reason, it means something is wrong with your blood or bone marrow. When cancer cells begin to grow out of control and often invade nearby tissues, this bleeding occurs. This invasion damages nearby blood vessels. This makes them more likely to rupture and bleed. In addition, some types of cancer can change the way the body's blood clots. If you get cut or injured, your blood may take longer to clot, which means you will bleed for a longer time. This can happen because cancer cells can produce things that keep your blood from clotting properly. This could make it harder to stop the bleeding and make it last longer. Third, lump or mass. Imagine you're taking a shower or getting dressed, and you feel a lump that wasn't there before. It could be small and hard as a rock, or it could be soft and pliable. This discovery is frightening, and for good reason. Many of these lumps are harmless, like cysts or lipomas. But it is very important to have any new lump examined by a doctor, because lumps are one of the first signs of cancer. These lumps appear when cancer cells begin to multiply too quickly and form a tumor, which is a mass of altered tissue. You may see or feel these lumps as they grow larger, especially in places such as the breasts, testicles, neck, or armpits. Sometimes these lumps don't hurt at first, so if you find a lump or mass, don't ignore it or wait. Make an appointment as soon as possible with your doctor for an examination. We don't have to think about swallowing. It is a natural process that allows us to enjoy food and drink. But what happens when swallowing is difficult and every bite seems like a chore, and eating is no longer fun? If you have trouble swallowing, this is called dysphagia, and it could mean you have cancer in your digestive system, such as esophageal, stomach, or throat cancer. Dysphagia can manifest itself in different ways. You may feel as if food is trapped in your throat and it may hurt to swallow it. Or you may feel tightness in your chest after eating. If a tumor grows in the mouth, throat, esophagus, or stomach, it can block or narrow these passages, making it difficult for food and liquids to pass through. Because of this, it becomes more difficult to swallow. The skin, which is the largest organ in the body, often shows what is going on inside. It is important not to overlook any changes in the skin, no matter how small. Skin that changes color, such as darker or lighter spots, may be a sign that something is wrong. Also, pay attention to changes in the appearance of the skin, such as it becoming dry, peeling or thicker in places where it normally would not be. It is very important to keep an eye on moles. Most moles are not dangerous, but if one changes color, shape, or size, or if it starts to bleed or itch, it could be a sign of melanoma, a very dangerous type of skin cancer. In addition to that, if you get new moles, especially after the age of 20, you should consult a specialist. Remember that not all skin changes are signs of cancer, but it is always a good idea to be safe and consult a doctor if you are concerned about something. Bowel changes are not something most people talk about, but they can tell you a lot about your health. One of the first signs of cancer may be changes in the way you go to the bathroom. For example, a growth in the colon or other parts of the digestive system may prevent stool from moving normally, leading to long-term constipation. Cancer cells also give off harmful chemicals, which cause the lining of the digestive system to swell and bleed. This can cause diarrhea or the urge to go to the bathroom. This inflammation disturbs the nerves in the intestines, which can cause pain or changes in the way waste is eliminated. These changes can be painful or even embarrassing, but are necessary to detect health problems early. Prolonged constipation could mean your colon is blocked, while prolonged diarrhea could mean your colon is inflamed or even has cancer. Also, watch for other changes, such as darker stools or stools that are lighter than usual, or the idea that you haven't gone at all after going to the bathroom. The scale can be a friend or a threat, but when the numbers go down for no reason, you should pay attention. We're not talking about losing a few pounds after making a conscious effort to eat better or exercise more. We're talking about losing a lot of weight quickly and obviously for no reason. In healthy situations, cells get most of their energy from glucose, a type of sugar found in the blood. Glucose is converted into energy, which the cells need to do their normal work through the body's normal metabolism. Cancer cells, on the other hand, work differently. Cancer cells often have a metabolism that works harder and is busier than that of normal cells. To grow and stay alive, they need more energy because of this. Because of this, cancer cells tend to absorb a lot of glucose from the body. It is possible for other cells in the body to run out of glucose when cancer cells use up a lot of it. When normal cells do not have enough glucose, they cannot produce as much energy, which can help people lose weight. Talk to a doctor right away if you notice you are losing weight without trying. This is especially important if you lose more than 5% of your body weight in 6 to 12 months. Sometimes our bodies send us pain to let us know that something is not working right. The pain is not always temporary, like when you get hit or fall. But if the pain persists and doesn't go away, it's a sign you shouldn't ignore. Any part of your body can feel this constant pain, and the level of pain can change. It could be a slow, nagging pain or a sharp, stabbing pain that stops you in your tracks. The important thing is that this pain will not go away, and it hasn't been diagnosed or given a clear cause. Depending on where you are, chronic pain can be a sign of different types of cancer. For example, chest pain that won't go away could mean you have lung cancer, while stomach pain that doesn't go away could mean you have ovarian or pancreatic cancer. This happens because the cancer cells begin to put pressure on the nerves, muscles, and organs surrounding them. There is pain in the area because of this pressure. In addition, the cancer cells can cause an inflammatory reaction, which increases the sensation of pain. If you have pain that does not go away with regular treatments and has been going on for more than 2 weeks, you need to see a doctor immediately. 9. Wounds that do not heal. The most common bruises we all have are small cuts, scrapes, and even small burns. These scars will improve with some care and time. What to do when a cut does not improve as days turn into weeks, and a simple pain still does not seem to get better? Cancer occurs when cells grow out of control and improperly. Cancer cells can interfere with the normal wound healing process when a tumor is nearby. This can prevent the skin from healing properly. Cancerous growth can also spread to nearby tissues, including the skin around a wound. There is the potential for this invasion to make it difficult for the body to heal the wound. The immune system, which is very important for healing, can also be damaged by cancer. The body may not be able to heal cuts as well if the immune system is weak due to cancer. Today we look at 9 vital signs that could be signs of cancer, and there will be more. feel free to add to our discussion in the comments. If you know of any other signs or have had experiences that make it more interesting, your skills and information are very helpful to our community. We should not ignore these warning signs. Detecting something early is a powerful tool that can save lives, including yours. As soon as you notice any of these signs in yourself or someone close to you, you should consult a doctor. Remember that the best thing you can always do is to avoid problems. If this video has made your day better and you think it could do the same for others, please like, subscribe, and turn on notifications so you don't miss any health videos. Have a great day and see you next time.